Doing well today? Good, good. Well, good afternoon, everybody. Thank you very much for being here for our update with regard to how the state is working to slow the spread of coronavirus here in Nebraska. We've got a couple of guests that are going to be with us today. President Ted Carr from the University of Nebraska. And you guys are supposed to be standing farther apart, just so you know. Okay, Ted, you can come over here by the flag. Why don't you come over here by the flag? Spread out this way. And then Stephanie Beasley, who's our director at the Department of Children and Family Services. And so we'll get to them in just a moment. But again, I just want to, as always, start off by reminding people about our 21 days to stay home and stay healthy. Stay home, stay healthy, stay connected. And of course, our 6 rules to keep Nebraska healthy. We want to make sure everybody's focusing on stay home. Don't take unessential trips outside the home. We want people to stay home. Second, we want you to make sure you work. Go to work. Work from home if you can. Socially distance properly if you're going into the workplace. Third is shop. Once a week. Be efficient. Have a list. Don't take your family with you. Fourth, help kids socially distance. Avoid playgrounds and group sports. Have kids play at home. Fifth, help seniors. They may need errands run for them to help them stay at home. So if you can help those folks in your neighborhood who may need that done, help them out or maybe go shopping for them or something like that to help seniors be able to stay home, but don't go visit them in the long-term care facilities. And then finally, number 6, exercise. Exercise to stay healthy, do it at home or with a socially appropriate, socially distanced exercise activity. So we want you to exercise, just make sure, again, you're following all the rules around social distancing. So those are our 6 rules to stay healthy, so I want to remind everybody of those. Also, we have something here today. It is American Sign Language Day today. And I think I've already mentioned in one of my previous briefings what a great job Frances is doing here today. And so Frances does not know about this, but we are making her an admiral in the great Navy of the state of Nebraska. You're welcome. Thank you for all your great work, Frances. Appreciate it. All right. So next I want to talk about a program that we are launching today, or a survey we're launching today, called the Nebraska Business Response Survey. This is a survey that we want Nebraska businesses to fill out, and not only Nebraska businesses, but nonprofits. It's a survey that we want people to fill out to be able to get back to us with regard to how this coronavirus has impacted their operations. So it was a cooperation between the Nebraska Business Development Organization at the University of Nebraska and our Department of Economic Development that helped put this out there so that Nebraska companies could share with us what is happening to them with this pandemic. This is an opportunity for Nebraska businesses to have their voice heard and to be able to share with us what's going on as we think about how we plan for future growth, as we think about our planning to help recover from this pandemic virus. So we really want Nebraska businesses to start filling this out right away. We have a website. It is cpar.unomaha.edu. So cpar.unomaha.edu/any business response. Any business response. So if you go to that website, you can fill out this response survey. We'll start seeing those results right away as soon as you start filling it out. There are a number of people I need to thank who helped put this together. So I'll just start with this, and then I'm going to turn over to President Carter to say a few more words. I want to thank the University of Northern Iowa Institute for Decision Making, Dr. Josie Schaefer, Director, Senior Research Associate, UNO Center for Public Affairs Research, Dr. Eric Thompson, I'm sure many of you have heard his name before, Director of UNL Bureau of Business Research, Dr. David Dearmont, again, a name I'm sure is very familiar to folks, Research Administrator, Nebraska Department of Economic Development, Pete Thompson, Chief Information Officer of the Greater Omaha Chamber of Commerce, Dan Curran, Deputy Director, Nebraska Department of Economic Development, Kate Ellingson, Communications Manager, Nebraska Department of Economic Development, Holly Salmi, the Vice President of Public Affairs and Policy, Nebraska Chamber of Commerce and Industry, Michael Johnson, Senior Director, Brands and Communications, Greater Omaha Chamber of Commerce. Kathy Lang, I'm sure many of you are familiar with Catherine as well. State Director, Nebraska Business Development Center. Dr. David Rose, Research Coordinator, UNO Center for Public Affairs Research. Dr. Chris Decker, UNO College of Business Administration, Economics Department. Chris Whitney, Communications Coordinator, Lincoln Chamber of Commerce. I also have Brian Sloan, who is the President of the State Chamber, who's in the audience today, as well as Tony Goins, who's our Director for the Department of Economic Development. Again, as you can see, this is a team effort to be able to bring the survey to Nebraska organizations to be able to share what is going on with regard to this pandemic. So again, we encourage people to fill out the survey immediately. Just again, that email address is cpar.unomaha.nebusInessresponse. So Nebraska Business Response, any business response. With that, President Carter, I'm going to go turn it over to you to say a few words.
Thank you, Governor. Good afternoon, everyone. I'm President Ted Carter at the University of Nebraska System. I want to first of all say thank you to Governor Ricketts for his leadership and all that he's doing to protect Nebraskans and making us ready to bring our economy back. And we at the University of Nebraska, as many of you know, are doing everything we can to protect our students, our faculty, our staff, while continuing on with our academic mission. A lot of what we do is also in the research side, and that is our part in partnering in this survey today. I want to say thank you to Brian Sloan and Tony Goins, who have been great partners with us as well in economic development in the chamber. But for us, we had a significant part in this survey across multiple parts of our campuses. So as the governor mentioned, Kathy Lang at the Nebraska Business Development Center at the University of Nebraska at Omaha. Also at the University of Nebraska at Omaha is our Center for Public Affairs Research. At the University of Nebraska at Lincoln, we have our Bureau of Business Affairs. And finally, at the University of Nebraska at Omaha, our College of Business Administration. All of those elements came together in helping develop the survey. Now, as the governor said, we're very hopeful that people will start filling out those surveys to help us bring businesses back to life. I know a lot of people are in need. I understand a lot of that data will become available as those surveys are being filled out. And I want to also let people know that there are other elements of the University of Nebraska that are also there for resources. So for example, our extension specialists that are located throughout the state, they are there just as they helped during the flooding last year, as they help in helping across all elements of agriculture and ranching. They are there to help with business development. At the Institute of Agriculture and Natural Resources, we have an organization that helps in manufacturing as a partnership, something that I know the governor feels very strongly about. They can help advise for small and medium-sized businesses. And of course, our Childhood Early Development Center, they are also a good partner in helping as we hear a little bit more about the need for child care going forward. And finally, I'd just like to say there are other resources available through our University of Nebraska website, a page called SourceLink that is the connection between some of our manufacturing partnerships at the Institute of Natural Resources, as well as our extension. So please check that out. A lot of great information there that can help with businesses as they get back on their feet. And finally, again, I'd just like to say thank you to the governor for his leadership. Right now, we are a proud partner to say that we are interested in protecting Nebraskans primarily for their health, but in addition to that, being ready to open up our businesses and get on with our economy. So thank you very much for your support, and thank you for supporting the University of Nebraska.
Great. Thank you very much, President Carter. Appreciate it. As many of you know, the 10-person rule that we put in place on March 16th, so almost a month ago now, had a big impact on a lot of organizations. One of those organizations were daycares. And many daycares were not able to continue to be open. We limited the size of daycares to 10 children per room, and so that had a big impact on the daycare industry. Now, we also have a number of families that we support through our Department of Health and Human Services that need that daycare to be able to go to work for the parents and everything like that. So what I have done, in addition to the work we have already done with regard to daycares and the guidance we put out there, and by the way, that guidance is out there at www.ne.hhs.gov/coronavirus. You can go out there and find the guidance we've previously put out, but I also signed an executive order today that will waive a couple of statutes that will allow the Department of Health and Human Services to reimburse daycares even though the children aren't currently there because of the coronavirus. So for example, you may have a parent who wasn't able to send that child to the daycare. Normally what would happen is that daycare would not be reimbursed for that day. However, this is a way by allowing the Department of Health and Human Services to reimburse that daycare to help those daycares stay in business and, importantly, to hold that slot for that family so that they will be able to take advantage of that slot sometime in the future. So it's really kind of a win-win. Helps the daycare stay in business, helps the family hold that slot, especially for, again, we're talking about our families in need to be able to hold that slot in the daycare. That's going to be an important thing for those families, and I waived another statute that will allow the Department of Health and Human Services to be able to provide in-home daycare for those families who maybe have a third shift or something like that. But again, really working to try and make sure that our families who are in need have that opportunity to be able to make sure they're taking care of their kids, especially if they've got an odd shift and a child with a disability and so forth. That will be some of the flexibility the Department of Health and Human Services now has to be able to do. So Stephanie Beasley, who is our Director for Children and Family Services, will next come up and talk a little bit more in detail about what that executive order will do and how it's going to help our families here in Nebraska. So with that, Stephanie, I'm going to turn it over to you.
Thank you, Governor. Good afternoon, and thank you, Governor, for your support and leadership on this important topic. Children and Family Services provide support and services to many Nebraskans in need. We focus on providing children the opportunity to succeed as adults, help the elderly and disabled live with dignity and respect, and help families care for themselves. At this time, the COVID-19 public health crisis has caused a significant disruption in the lives of Nebraskans and for all Nebraskan families, including those families served by CFS through child care subsidies. As of this morning, 481 or 16% of our licensed child care programs in Nebraska have temporarily closed since the COVID-19 emergency declaration. This means that 26% or 4,421 out of 17,213 children whose families receive child care subsidy from the state do not have access to safe, high-quality child care for their children while they either look for work or continued to work to provide for their families. The problem is not unique to Nebraska. The nation as a whole is grappling with the loss and closure of child care programs in every state. For instance, the National Association for the Education of Young Children recently reported their internal data shows that as a nation, child care programs lost 70% of their daily attendance in 1 week. Families need care to work. And in order to serve Nebraska's workforce, the Department of Health and Human Services is continually working on innovative and proactive policies that help serve families and strengthen our local communities. This is why Governor Ricketts has announced 2 initiatives that will help families currently receiving child care subsidies as well as help child care providers. First, starting today, families currently receiving child care subsidy who may be experiencing a child care closure will have the option of using a license-exempt in-home child care provider. This is an individual who will go to the home of the child to provide the care. Our current regulations require families receiving in-home subsidies to meet one of 3 criteria. The criteria are unusual work hours, more than 3 children receiving care, or a child who has special needs receiving care. These criteria are temporarily being waived by this executive order. Importantly, as in current practice, the person providing in-home care still must be 19 years of age, pass all applicable background and criminal background checks, and complete the department's health and safety orientation training. This option to child care subsidy families provides at least 2 benefits. First, this provides an alternate child care option for a family who may have lost their child care due to their provider or program closing. And providing this option also provides new employment opportunities for interested individuals who may have lost their employment from the COVID-19 pandemic. This could be a temporary unemployed relative, neighbor, or friend. Second, we recognize the important and critical function child care programs have in sustaining a stable workforce for Nebraska now, but also for when this pandemic ends. That is why Starting today, the division will allow licensed child care subsidy providers to bill for times when subsidy children are absent from care during this emergency declaration. Current regulations in Nebraska do not allow providers to bill the department for these absences caused by the pandemic. Many families are keeping their children home, are temporarily not working. They are working from home or simply keeping their child home to be safe and reduce exposure and limit and flatten the curve. This has had a negative impact on our child care providers and programs who, by no fault of their own, have seen a significant reduction in their income due to this crisis. This temporary decision will help sustain licensed child care subsidy providers and help ensure families we serve have access to high-quality child care. Importantly, a child care program is eligible to bill for absent days as long as they remain open or if they reopen. As child care providers cannot bill for days that the provider closed their program and can only bill absent days up to the authorized hours the child typically attends their program. Providers will have to sign and submit an addendum to their existing subsidy agreement, and this form is available on the DHH website and in our child care frequently asked questions posted on that website. Instructions regarding submission of this addendum can be found there. This executive order will provide financial support for child care subsidy providers, allowing their businesses to stay open and provide care for children for working families. These decisions will help ensure families can continue to access high-quality child care across the state, providing new opportunities for employment for some Nebraskans who may have lost their job due to COVID-19, and support local communities by ensuring we maintain the child care network across our state. Thank you.
Great, thank you very much, Stephanie, and thank you very much with your help and your team's help on that executive order. Appreciate it. Okay, next, just want to give an update on the Paycheck Protection Program. For those of you who may not be familiar with this is a program through the Small Business Administration. It's a loan to small businesses to be able to help them out through this difficult time of the pandemic. It was administered through banks and the Small Business Administration, and it was a program that was very well subscribed. I mean, we had lots of businesses here in Nebraska, so much so that you may have heard about some of the difficulty being able to get through on the SBA's website. We just got the report yesterday that 18,565 Nebraska businesses applied for that Paycheck Protection Program. So they got a loan that basically keeps their teammates on board and employed. 75% of the money has to be used for that payroll to be able to keep people on board. 18,565 companies applied for it and received over $2.7 billion here in Nebraska to help those businesses. And just to put that in perspective, that was actually more than some states that have more population like Oregon and Utah got from the program to date so far from their applications. So again, a program that has been very successful here in the state of Nebraska in helping Nebraska businesses to be able to keep people employed. Second, I want to talk about, I often talk about some of the great work that goes on in people responding back to this pandemic. And today it's a story about the Nebraska State Patrol. N95 masks are kind of those heavy-duty masks that people have been wearing, and they are in short supply. And so the Nebraska State Patrol, looking for alternatives, looked at the gas masks that they have, and every trooper's got one. And the filters for those gas masks were running in short supply. So they found some filters from an older gas mask that would work, except they didn't quite fit in the new gas mask, but stepped up into that Kawasaki and Into Metal. They worked together with the Nebraska State Patrol to take those filters, find a way to be able to modify them and fit them into the gas mask. So that will allow our Nebraska State Patrol to be able to use those new modified filters in their current gas masks, and thus help save on those N95 masks that are in such short supply for our healthcare workers, other law enforcement, and so forth. So just want to say thanks to Kawasaki and Into Metal, and of course, great work by the Nebraska State Patrol, again, looking for creative and innovative ways to get their mission accomplished. And then just want to give an update. I've been saying we're going to be doing these press briefings at 2 o'clock the rest of the week. President Trump is actually having a phone call tomorrow at 2 o'clock with the governors, so we will be moving the press conference tomorrow to 1 o'clock Central Time. Matt Bloomstead will be here tomorrow to be able to talk about some education issues, and because I've got to be into that phone call over at our Nebraska Emergency Management Center, we will be making that a shorter session tomorrow to be able to accommodate the president's schedule for the 2 p.m. call he's having with the nation's governors. So just a heads up, tomorrow, press briefing, 1 p.m. Central Time, 2 p.m. Central Time on Friday. And then, of course, Thursday night, tomorrow night, I will be on NET from 8:30 to 9:30 with Dr. Ali Khan and Shelley Sweethelm from University of Nebraska Medical Center and Nebraska Medicine, talking about, again, the response to the coronavirus here in the state. And so with that, we'll go ahead and roll into questions and answers. So from Chris Stoom, NTV, during this time, temporary housing is limited and affordable housing can be a challenge. I've seen at least one community start a task force to help tackle the issue, but they say it's a problem everywhere around them. Has the governor been talking with his team about this? How are we addressing this to make sure those who need it are safe? Staying at home can be a concern for those fighting against domestic abuse, and that's where temporary housing comes into place. So with regard to, there's a lot of issues around that. So first of all, one of the things that we've announced is that for our law enforcement, first responders, healthcare workers, we've got our lodging program, which we've had people starting to take advantage of so that they would not be going home and being exposed to the virus or exposing their loved ones to the virus if they went home. So we've got people taking advantage of that. We also talked about some of the work we're doing with the University of Nebraska and dorms. We'll have more details about that at a later date as we finalize those plans. So a lot of the things we've been working on in the state have really been focused more on kind of the temporary response to the pandemic. The housing issues we have here in the state are something that, especially around workforce housing, have been something that is an issue that we've been working on here in the state of Nebraska for a while. So for example, Senator Matt Williams introduced LB 518, which created took $7 million to be able to give communities grants to be able to help develop some of that workforce housing. Those are typically longer term type projects that we're working on. So again, a lot of our focus has been specifically with regard to the pandemic, but we have been at the state looking at other ways to be able to address some of the housing issues we've got here in the state with other programs. But again, those typically tend to be longer term projects rather than the short term projects we've been working on with the pandemic. Grant Schulte, Associated Press, one question right now: why was revenue higher than expected in March, and how is April looking so far? Well, Grant, one of the things you may recall is that we actually had a number of months leading up to March that were exceeding our forecast. So the Nebraska economy was really humming along there, and we were generating revenues that were exceeding our forecast. March really didn't see the full impact of the pandemic. And as we get into April, I think we can expect, again, we'll announce those numbers, the April numbers when we have the April numbers finished up in the middle of May. It's typically when we do that. But what you'll see is there will be an impact on April numbers, but really it's too soon to know what that overall impact will be. Matt Wiesner, NTV. We received the below question from a viewer concerned that the 6 rules do not include using a mask. Can the governor address mask usage in the state, and if he/DHHS feel these should be a part of Nebraska's plan in fighting COVID-19? So when we put together our 6 talking points, we were really trying to get something that would be easy to remember and kind of hit upon some of the biggest bang for the buck kind of stuff we wanted to focus on. Obviously, the CDC has put out guidelines with regard to using masks, especially even just using cloth masks. We've got a number of our folks in the audience are wearing them today. We absolutely support that. DHHS did put out a press release on that, encouraging people to use that mask. It was just a matter of saying, we could keep making rules and rules and rules on what we were trying to get across, but if you make the list of rules too long, then people don't remember them. So we're really trying, we just, picked a place to do the cutoff, but if people want to wear masks, we certainly encourage people to do that. It's a great way to help protect others that you're interacting with as you go about your daily activities. So if you want to wear a mask, please do. It's encouraged that you do that. Shannon Hecht from KSNB has a lot of questions about the UNK quarantine sites. When would people start arriving? How soon will campus be notified? What's kind of the need? Where will people be coming from? And again, with regard to the program we've got for quarantine and isolation, in partnership with the University of Nebraska, We'll be giving more details on that as we're ready to roll that program out. So I just asked Shannon, just hold off on this a little bit. We'll get more questions or get more answers for you as we're ready to talk about that further. But we'll pick that up when we're ready to make the bigger announcement about how people can access that program for quarantine and isolation. And again, our program for people who want to just seek lodging, our first responders and healthcare workers, that is out there and available. But we got people taking advantage of that right now, but we'll get you more information on the quarantine numbers here in a bit, or program in a bit. Taylor, did you have other questions?
William Padmore with Catalan wants to know, is the governor convening a council to advise businesses in the state on when they should consider reopening?
So William Padmore wants to know, is the governor convening a council to advise businesses on when they should consider reopening? We are seeking feedback. Again, that's part of what this business survey is about, is to get the voice of Nebraska in here. How are they being impacted? We are starting to solicit people's feedback about what some of the criteria might be as when we start opening up, what would that look like, what would be some of the best practices around doing that. As I've said, as we do this, we will do it incrementally, a little bit at a time, or we're not going to just take all the restrictions off and May 1st and just start over from scratch. We are going to try and phase this in, and we are seeking feedback on that right now, but don't have anything to announce with regard to that, as we're really just in the early conversations or early part of those conversations.
Alexandra at KCD has two questions about testing. First is, can you talk about the difficulty with getting testing materials, and what can we do to get more?
So Alexandra from KETV is asking about testing materials and the difficulty getting those. Yeah, absolutely, it has been a challenge. I've been on the phone with the CEOs of the companies that sell, for example, the reagents, working on trying to get more of those into the state. That has been one of the things that has been a limit for us. We've been trying to make sure that with the resources we do have, the reagents we do have, we can still make sure we test those high priority people. And we are looking to be able to take up the amount of testing. We've got a number of different channels we're pursuing that through right now. Nothing I can share with you because we don't have anything definitive at this point. But we are working, and we are starting to see that we are starting to at least get some of the reagents in. One of the challenge, of course, is that we've got to have the whole complete package, right? You need the reagents, the extraction kits, the swabs, the viral media, the test tubes, all that's got to come together to be able to complete that supply chain, if you will, with regard to how we actually complete testing. And so that has been one of the challenges, just making sure we actually secure all those pieces of that are necessary to do that testing. It has been a challenge, but I feel like we're making progress. We'll probably have more news on that, in the future, but right now I don't have anything else to share until we actually get something definitive.
Erin Grace has two questions. One is, she talked to a couple people today who said it's unclear what's expected of them. Should they wear a mask or not? What is essential? And would a stay-at-home order help offer clarity around what's expected?
So Erin Grace is asking people who have, are wondering what is expected of them. Should they wear a mask? Should they stay home? That sort of thing. And again, I would refer to our 6 rules here, right? We want people to stay home, okay? No unnecessary trips outside the house, and really here's where we're asking people to use their judgment, right? This is a program that depends on people exercising personal responsibility and their civic duty to make that judgment about what do they need to do and what can they stay home, when can they stay home. This is about making that decision, not the heavy hand of the government coming in to take away your personal freedoms, but about people making that judgment, because we don't have enough police to sit on everybody's doorstep and tell them what to do. So if you want to wear a mask, please wear a mask. CDC has put out guidance that'll help protect other people. That's a great thing to do. But it starts with these 6 rules. Stay home. Work. We want people to go to work. It's important that people go to work. But if you can work from home, that's great. Work from home. If you're going into work, keep that physical distance, that 6 feet apart from everybody, so that we can slow the spread of virus here in our state. The 10-person rule, avoid groups of more than 10 people. That's one of the things that's been in place for almost a month now. So those are the types of things we want people to try to do when they're at work, in the workplace. Shop. Do it once a week. Don't take the whole family out. Just one person go out and shop. Those sort of things. Help kids. Don't play at the playground. Play at home. Help seniors. Help them so they don't have to go out. And then exercise, but do it at home or with a socially appropriately distant, activity. These are the kind of things that we want people to focus on, and use your common sense and best judgment about how you can personally take responsibility for fighting the spread of virus here in our state.
finally, she has a question. She's wondering if the stay-at-home order would help what's going on in Grand Island and Hastings.
So then Aaron Grace asks, would a stay-at-home order help what's going on in Grand Island and Hastings? And again, we are deploying resources there. And again, if you look at what, again, I just refer people, go read the executive orders that are in other states like Illinois or Arizona, and look what they have done with their shelter-in-place orders, and look at what we're doing here in Nebraska. Folks, in many ways, we're more restrictive than those other states. Dr. Fauci said we have the functional equivalent of asking people to stay at home, right? Those orders that are, in some cases in other states, not even enforceable by the law. So there's still, I think, people don't quite understand that here in Nebraska, we have taken the steps to slow down the spread of virus here in our state. Now, in places like Grand Island, where we've had maybe some unique circumstances, like manufacturing town and stuff to work from home, we are working to be able to limit the spread there. But the whole point of this is so that we don't overwhelm the healthcare system. And we have not done that in Grand Island. We have not overwhelmed the healthcare system. Now, are they working very hard? Absolutely. Those healthcare workers are working really hard. In about a week and a half, we've gone from maybe 3 people using a ventilator in Grand Island to 17 people using a ventilator, and a number of people being transferred from Grand Island to other hospitals. But again, that's part of how we work together here in Nebraska, to be able to make sure that if a community needs help, we supply that help. So the hospital systems are working together to be able to move people around, to be able to take care of them. The state has deployed more people into Grand Island to help with that contact tracing, finding people who have been exposed and making sure they're quarantining. We're also going to be, we had the National Guard doing testing in Grand Island. They were just down in Hastings, so that Tri-City area. They're going to be coming back to Grand Island through either Saturday or Sunday and doing more testing. So we are deploying resources to be able to address it. It's certainly something where people are working very, very hard in Grand Island, but the plan is working. We have not overwhelmed the healthcare system.
That's all I got for now.
Okay. Other questions? Yeah.
What is your reaction to the petition from those 1,700 employees that was dropped off this afternoon about wanting safer working conditions?
So the question was a petition from our state teammates. I believe they were asking for more money to work. And I guess my folks, hey, we're state government. We do really important things, right? Our folks, we've worked really hard to try and get people to where they can work from home. Can't work, but work from home if you can. And we've got about 30% of our workforce working at home. But folks, there are things that we have to do here in the office. Whether it's, children and family services, manning the hotlines to protect children and their families, or making sure that those benefits are getting out to those families. So, for example, that they have their SNAP benefits. We've increased the maximum allowable, the SNAP benefits to the maximum allowable, but they still got to get out, right? That still has to be, that work still has to be processed. Or think about our Department of Labor. We have had more people apply for those unemployment benefits since March 1st than we did in the previous 2 years combined. Those are Nebraskans that are hurting. They need our help. We got to process those applications. We got to get those checks out. Trust me, John Albin, our Commissioner of Labor, is working very, very hard, bringing people on board to be able to figure out how we can make sure we process those unemployment applications as quickly as possible. We're still shooting to try and hit our goal of that 21 to 28 days. And just to put that in perspective, even with all those applications coming in, it used to only take us 14 days. We're still trying to keep it within 28 days, which is the federal standard. So he's got a team that's working very, very hard, but some of that work has just got to be done in the office. Or our Department of Revenue, people looking for their tax returns, getting their tax refunds. Some of that stuff just has to be processed in the office. So our teammates, like the folks who are the truck drivers delivering food supplies, grocery stockers, our law enforcement, our first responders, our healthcare workers, we've got a lot of people who are working very, very hard in really unusual circumstances. Those folks are doing their part. We got to do our part at the state of Nebraska. Yeah, Andrew.
You're saying that other businesses are giving a $2 bump, for a certain time, to kind of show their appreciation for this work that they're doing. Why doesn't the state do that as well?
So the question was, other businesses may be doing a $2 bump. I don't have any. I know a couple of businesses that may be doing that. Actually, I know of one off the top of my head. but I don't know how many businesses are doing that with regard to paying additional. But again, I think this gets back to just the expectations of people in Nebraska. Hey, we're the state. We're supposed to be doing these things. This is what we do. This is our jobs to help serve people. That's why we are here to be able to do that.
We have a question from Charlie Brogan. He'd like more detail on the interhospital transfers and how many so far have been coordinated.
So Charlie Brogan would like to know more details about hospital transfers, and Dr. Antone, I'm going to call you up to talk a little bit more detail about that.
Well, first of all, I didn't know about this $2 bump, so I'm going to ask the governor for this $2 bump now that I know about it. But yesterday, specifically St. Francis Hospital in Grand Island did transfer out 5 different patients, all specifically for medical reasons that needed care at either University of Nebraska Medical Center, or Bergen Mercy Medical Center, or at other hospitals that could provide care to those patients. So there are a number 5 transferred yesterday, 2 the day before. And again, the beauty of that system is that it's all within the Catholic Healthcare Initiative, the CHI system. But again, we have the cooperation of every hospital in the state to do interhospital transfers if that's necessary. So definitely it's been done. We've obviously transferred patients from some skilled nursing facilities, assisted living facilities into the hospital system. The coordination has been great. We've got good transportation issues set up. So far it's worked just as we've planned it, and hopefully it'll go forward like that. The governor mentioned as far as Grand Island being sort of the hotspot right now, I'm in communication with the CMO of that hospital, at least on a daily basis, sometimes twice daily basis. And even though they are working extremely hard, they still feel that things are under control in their facility. So we have great bed capacity throughout the state. 50% of the beds in the state now are unoccupied and ready to be occupied at any time, similar for ICU beds. So far we haven't overwhelmed the healthcare system whatsoever. I think it was my daughter that sent me this, I think it was a YouTube video, and I wanted to mention it. Has anybody seen the one with the mouse traps and the ping pong balls? And how when they put that together, when they're side by side, and they put 100 together, and they throw a ping pong ball on top, every one of them goes off within like a few seconds. But if you space them apart like 6 inches, not one of them goes off. And that's exactly what we're doing. That's what the purpose of this distancing and non-pharmaceutical interventions are, is to prevent that rather than 100 going off, so that 10% of that 100 are going to utilize the hospital systems, that we don't do that. And so far, that's been what's been taking place. So I know that was a long answer to that question, but I didn't know if I'd get a chance again to say that.
Yeah,
Watch that video.
and yeah, Dr. Antone, I know you're always a microphone hog when you get up here. I get it. But again, I think but your point about the ping pong ball is exactly right, and it actually kind of goes back to what we were talking about with the questions about herd immunity or whatever. The whole point is to make sure that we spread this out, and we have been doing that, to make sure we flatten the curve so that we don't overwhelm the healthcare system, and it is working.
Governor, you mentioned this a month ago, you put in the first restrictions. And I think at one point you commented that after a month, we're gonna know some things. What do we know now after a month of these restrictions about the peak, about if things are working, if more things need to be done, or if things can be relaxed?
Yeah, so Paul Hamill, the World Herald, is asking, okay, so been about a month since we put these restrictions in place. I made a comment at some point, we'll know more after a month, and after a month, what more do we know? Well, I think the first thing we know is that we need to do more testing, and we're working on getting that capacity. We have not stressed the system out from the standpoint of PPE, though that remains a constant concern that we continue to bring personal protective equipment in and get it distributed out to our healthcare workers, law enforcement, nursing homes, so forth. And that the plans we have put in place have not overwhelmed the healthcare system, and that the non-pharmaceutical interventions that Dr. Antone was mentioning, they're working. That we have slowed out this process. We spread it out, we've taken the curve down. Now, part of why we know that is because we're looking at some of the models that are out there, and so, again, those are just models, just help us to think about it. But again, we know that ultimately the goal, which is not to overwhelm the healthcare system, has been achieved so far. That even where we've got a hotspot like Grand Island, as Dr. Anton was saying, St. Francis feels like, even though they're working really hard and they've had to open up new beds, that they've got it under control. And again, assisted by the hospitals in their system, but as Dr. Anton said, every hospital in Nebraska has stepped up to say, hey, we will take patients, we will be a part of the team.
What do you know about restrictions, though? Some people say, let's drop them right now, and other people are saying, we're gonna be dealing with this next year.
Yeah, I think, again, the question was, well, what about restrictions? How do we know they're actually working? Or maybe this was, just as some people thought, maybe a hoax. This is real. And I think what you see is that when you have success, it doesn't seem like we're being impacted like states like New York, so people maybe question, was it a real thing? That's kind of an indication of success, that we can see in our country states like New York where they have been severely impacted by this because they were not able to take those interventions early enough. We here in Nebraska were able to take those interventions early enough and did not see the same sort of impact as states like New York. So I think that that's an indication that what we're doing is working, that we didn't have our healthcare system overwhelmed the way a state like New York did. So because we moved earlier relative to when we had the virus here in our state, we were able to have schools start operating without students, do the physical distancing, that 6 foot, reduce the size of crowds to 10 people. All those sort of things really slowed the spread of virus here in our state.
Does that change your thinking about when the peak will be?
Does it change the thinking about when the peak will be? Well, you look at the models, you think about it. Does it mean it might have been pushed out? Potentially, but it also means that we're able to handle it even as we see the number of cases continue to go up. And we got to continue to watch that trend, to see, how fast cases are going up. But again, we're still collecting data on a lot of this stuff, but I would say the things we've done here in Nebraska, we can say from the evidence of how many people are testing and how many fatalities we've had and how many ventilators we're using, all that what we're doing is working. Andrew. No, Fred. Andrew already asked a couple of questions, so.
A couple of the examples that the union people gave, they said people or members of the public are coming down to the DMV and getting driver's licenses, having to press their faces up against some sort of glass device. They also say that workers are in cubicles that are smashed right up against each other. Are there further steps that can be taken to mitigate some of the risks?
So the question was, for our state teammates, are there further steps that we can do to further mitigate the risk? And, look, I'm all about continuous improvement, that no matter how well we do something today, we can do a better job tomorrow. So I would say that to those teammates, if they've got specific ideas on how we can improve a work process, this is something that we've done through our continuous improvement process, our Lean Six Sigma efforts. We've already been doing this with business processes, so there's already really kind of a way to do that through our team huddles and so forth. Talk to your supervisor. Talk to them about, because we actually have, process in place to do that process improvement and figure out how we can do things better. This would be a great application of that Lean Six Sigma process to be able to look at how can we do more with regard to that physical distancing, making sure that we're slowing the spread of the virus. A great opportunity to be able to use the tools we already have given our teammates to be able to do that. Yeah.
Actually, I had a question for President Carter, if you would mind.
Sure.
Basically, I'll cut right to the chase. Do you think there will be college football this fall without students on campus?
So that's a question that's popping up all over the nation. And, as a lot of you know, yeah, the question is, do I think there'll be college football this fall if we don't have students on campus? And obviously, I'm paying attention to conversations at the Big Ten, at the NCAA level, at the Power 5 level, and across all of FBS. So you think about FBS, there's 130 teams all across the country. And you talk about how complicated it is to come up with a solution that fits all 130 teams and all the Power 5 and the Group of 5 components of that. And what I've heard is from coaches and athletic directors is, first of all, they don't believe football should be played in front of empty stadiums. The fans are part of the college football experience. I don't know whether that means half-full stadiums or, fans that are spread apart by, following some of the physical distancing limits that we have now. But here's my view, and this is Ted Carter's view, all right? And this is reading much of the same stuff that's out there as everyone else. I'm a glass half-full guy. And what I see has happened here in Nebraska is a lot of good behavior, people doing the right things. I think people across our nation are trying to do the right things so that we can get back to some sense of normalcy. I think it'll be a long time before we see what life was like maybe a year ago. But I do think there are going to be return of professional sports to some level, and certainly NCAA sports. Now, whether that means college football starts being played in the last week of August, first week of September, or maybe even November, I think there'll be a lot of new ideas for how to make sure that we keep competitive spirit, the brand of all of our colleges and universities. We as Americans love our athletics. So as you've seen the Olympics move right to the year, you've seen other things change, the Masters move, I think we'll find a way that suits everybody but keeps people as safe as possible. And from my view, I'm looking forward to seeing football back in Memorial Stadium with some number of fans there and cheering on Go Big Red.
So, just to follow up, because Dr. Fauci was asked this question, I think, like on a podcast earlier this morning. He said the only way you can have college football this fall is in an empty stadium, and you have to almost quarantine the players and stuff like that. You don't see that as a feasibility with your discussions with people?
I'll be the last person to contradict Dr. Fauci, but I will tell you that there's still a lot more for us to know. As Governor Ricketts has said, I think the key to what will allow us to do a lot more will be a lot larger access to testing, large-scale testing, so that we can have a sense of how big the challenge is, how many people have through some other types of testing know that they've already been exposed to this or have already had it. So we're about 5 months away from college football. A lot has to happen for us to get back to that to being on schedule. But I'm going to remain optimistic for now that, I'm still optimistic that we'll have students on campus by the fall and that we're in the classroom. We've already committed to not teaching in the classroom for the summer. UNL and UNO, we're going to be remote just as we have been in the spring. But we are working all options, all plans. And again, I'm optimistic that we'll have students on campus in the fall.
Yeah, Andrew.
Governor, since you're here, Mr. Sloan's here as well, I mean, a lot of people have.
So wait, is this a question that I can dump off on Brian? Is that what you're saying?
But, how is the best way for people to spend their stimulus check to help Nebraska businesses as well as help Nebraskans?
What is the best way, Andrew's question was, what is the best way for people to spend their stimulus check to help Nebraska businesses? And I would say that you just continue to do what you're doing with regard to supporting our restaurants. Nebraska is the number 2 state for takeout. We have Takeout Tuesdays to help promote it and support the people in the restaurant industry. If you look at the people who are applying for unemployment, we know that the restaurant industry has been dramatically impacted by that. So that's a great way to continue to support Nebraska businesses. Brian, I'm going to actually ask you to come up, and if you want to say a few words about what you think people could do for Nebraska businesses, that'd be great. So Brian Sloan, the president of the Nebraska State Chamber.
So the first thing is everybody has to take care of their families first in terms of what to do with these stimulus checks. But in terms of supporting businesses, absolutely, I would agree with the governor, is support those businesses that are hardest hit. And the hardest hit businesses are those Main Street businesses, particularly our restaurants and dining out, but also our retail stores that are open. And so in many, many communities, local chambers are also running gift card campaigns. And I would also raise those to everybody's attention as a way to support your local businesses. Some businesses who cannot be open now, those gift cards give them a source of revenue through the rest of the year. So contact your local chamber. Each local community has different programs, and it does make a difference, and it keeps those businesses going in our downtown communities, which is absolutely essential. So thank you. Thank you, Governor.
Thank you, Brian.
Governor,
Fred.
what would you say to somebody who says it's all well and good that people who qualify for child care subsidies have the benefits that we were talking about earlier, but middle-class folks don't get that, don't have those options?
So the question from Fred was about, hey, while we got families who are low income that qualify for those child care subsidies, and it's great that I've waived an executive, or I've issued an executive order to waive some of the requirements to allow them to be able to continue to have that access. What about the middle class families? And again, this is one of the reasons why we continue to focus on, how we're helping those child care facilities stay open in the first place. That's why we issued that guidance, almost a month ago now, with regard to the 10-person rule with each room for those child care facilities. So it wouldn't just be 10 kids in a big old, facility with multiple classrooms, but be able to keep them in one room, to be able to, move them or not move them around, so we keep that virus from spreading, but still allow that access as much as possible to those families.
Right, but you prefaced the introduction of the new measures for the subsidized people by saying, despite that, a lot of daycares have shut down. So,
Yeah.
so that affects middle-class
Yep.
people as well as subsidized people.
Yep, so again, and as Fred points out, a lot of these facilities, these health daycares have shut down. So again, part of it is we got to get back to looking at how can we, once we get, through the month of April here, start looking at what can we do to start opening up the economy more, creating more of those opportunities for those daycares to be able to have customers and come in and get people back to work and all that. It's going to be, there's no doubt, Fred, it's a challenging time for everybody here in the state of Nebraska. And we know that one of the obstacles, for example, to some people going back to work is the access to the child care. We've tried to, again, prioritize some of the folks like our first responders and our healthcare workers and, people involved in public safety, those middle-class families to be able to get access to that so they can be prioritizing public safety. But we know there's other families out there that aren't going to qualify for that. And again, we just got to get back to more businesses opening up, to have more parents have the opportunity to be able to use those daycares. So part of the answer will be, as we get through this month, looking at what are the steps we can do to start loosening up some of those restrictions. And that's why we're going to have conversations with the industry to kind of figure out how we step into that as we get past the month of April.
Time for 2 more questions.
2 more questions. Yeah, Andrew.
Rob asked me to ask you this question. There are a lot of seniors.
Wait. Rob asked you to ask me? How come Rob didn't ask Taylor to ask me?
Seniors are very at risk for depression and anxiety because of isolation. Family members help those elderly loved ones who are isolated. But what can the state do to help some of the seniors cope with this mental stress?
Yeah, certainly one of the things we know is with the seniors being isolated, say in a nursing home or something like that, that isolation creates stress. You can't see your family members. And what can the state do? And I think it really is one of those things where, we're working to keep the folks safe there with regard to the virus. When it comes to that isolation, I'd really encourage families to reach out. There's things like Zoom out there, a software program that allows you to be able to talk to those folks as well as other family members in multiple locations so that you can all keep properly socially distanced. It's one of the things my family's taken advantage of, to be able to talk with, for example, my in-laws and my parents when we haven't been able to go see them. I think I've dropped off a package at my mom's house once over the course of the last month. That's the only time I saw her actually face-to-face. The rest of the time have been through either phone calls or using something like Zoom. And that's what I'd encourage people to do, is have those families really take advantage of the technology that's out there to be able to get to overcome some of that isolation and make sure that people have got that connection. And again, this gets back to our motto: stay home, stay healthy, stay connected. Find ways to be able to stay connected with folks. And other people were doing things, and, I'd ask you to reach out for Nebraskans who maybe don't have somebody who's in one of those facilities. But, Nebraskans used to go, just visit people in skilled nursing facilities, for example. You can't go visit them now, but there's no reason you can't make arrangements with that facility to be able to do a FaceTime or do a Zoom or something like that with the residents, and just spend part of your time, as Nebraskans, just contact a facility that's in your community, ask to be able to talk to them, talk to one of the residents, and just share 10, 15 minutes about what's going on in your day, and bring them up to date on what's going on in the world and that kind of thing, just to help break down that isolation. Again, that's something that every Nebraskan can be a part of. Every Nebraskan can be helping break down that isolation by contacting a facility in their community to be able to talk to somebody, one of our seniors who's there and can't receive visitors. Yeah.
This is probably for Dr. Antone again, but just an update on Grand Island. Can you confirm how the 7 that were transferred, were those all COVID patients, and have there been any transferred today, and how many beds are open in Grand Island?
So Dr. Antone, you want to come up and address that question with regard to how many patients transferred with COVID, how many were transferred today, that sort of thing?
So after my morning conversation with the chief medical officer at Grand Island, nobody's been transferred yet today out of Grand Island, to my knowledge. And the first part of the question was, were all the patients that have been transferred COVID positive? And yes, that's true.
And do you know how many beds at CHI or Grand Island are open at this
The actual bed capacity at the hospital is excellent, greater than 50% vacancy rate at the general hospital. The ICU has 16 beds, and as the governor said at one time, they had as many as 14, 15 on ventilators in the ICU. And still, when I talk to the CMO, when I call him up, I always expect him to be like under stress or something. And he's always so calm and asking me how I'm doing, rather than me asking him how he's doing. But I think he knows he has the support of all his co-hospitals and other doctors that come in and support them, the pulmonary critical care doctors that come up from either Omaha or Kearney to help him out. And it's amazing, the cooperation, so.
And maybe just to wrap that one up, when we were on one of our calls earlier this morning as well, I know that CHI was actually mobilizing more resources from around their system to actually send to Grand Island to be able to help out too. So again, we got lots of people who are pitching in to be able to make sure we take care of Nebraskans here in our state. And again, that is the whole point of all that we're doing, is to make sure that we slow down the spread of the virus here and not overwhelm our healthcare system. So again, folks, thank you all very much for joining us here this afternoon. We will see you back tomorrow at 1 p.m. Central Time. So remember, because of the President's call, we're moving the time. Friday will be 2 p.m. again. Thank you all very, very much to every Nebraskan who is helping to slow the spread of virus here in our state. It is working. Hang in there. We got more work to do, but the steps we are taking are working. We will get through this together. Thank you.